0-0.
Thank you. Director Harrington?
Present.
Thank you. Director Munar? Is absent. Director Story?
Present.
And Chair Ryder?
Here.
And for the record, those directors also present. Director Curry?
Present.
Director Guggenheim?
Present.
Director Ketting?
Present.
You have a quorum.
Thank you, Debbie. And I should note that pursuant to the Illinois Open Meetings Act, meetings held remotely will require roll call votes for all action items. To streamline, we're combining them as we have been into one combined motion unless circumstances call for us to consider something separately. So hopefully only one roll call vote will be needed during the meeting. Meetings of the Board of Directors of Cook County Health and Hospitals and its committees are expected to be held remotely until a date determined due to the current circumstances concerning COVID-19. Debbie, is there any public testimony?
We did not receive any.
Thank you. Moving on, the Finance Committee meeting minutes from June 17, 2022. These were approved by the board at the June meeting. Are being presented for the committee's review and discussion if necessary. Are there any corrections that need to be made to the minutes? Are there any corrections that need to be made to the minutes? Any corrections? Hearing none, we're going to hold the minutes for the combined motion that we'll be considering later in the meeting. We're now going to go to items under the Chief Procurement Officer, but we're going to be having several different people presenting based on who the contract sponsors are. So that's correct, right, Charles?
Yes, sir. Good morning, Charles Jones, Chief Procurement Officer. Each
All
executive
right.
sponsor will present their contract.
Okay, great. So I think we're going to first go to, and apologize if I screw up any of these names, but Dr. Lamar Hosbrook, Cook County Health's Department of Public Health's Chief Operating Officer for item number 1.
Great. Good morning, directors. We just have one item for your review and consideration. It is a contract grant with the Illinois State Department of Health, and it's for a 3-month extension for some work that we're doing in terms of COVID services and outreach, targeting a high-risk population, a Latinx population. So that's an extension that brings us over the 150,000 threshold. Happy to take any questions.
Any questions? All right, hearing none, we're going to go to action. We're going to go to items 2 through 4, which are going to be presented by Aaron Galiner, Interim CEO, Health Plan Services. Aaron.
Morning, directors. There's 3 items that the health plan has before you. The first 2 relate to Med Impact, which is our PBM. It is exercising the first of our renewal options for the contract. The first transmittal is related to the claims component, and then the second transmittal is related to the administrative cost. In relation to the PBM, there is a current RFP that is posted, but exercising of the 1-year renewal option also ensures we have enough time if there is a transition that is needed in 2023. And then the third transmittal is our Guardian, our dental and vision claims benefit manager. Again, this is exercising the first of a 1-year renewal option from the original contract RFP. And this amount includes both claims and the administrative cost. Happy to answer any questions.
Any questions for Aaron? All right, hearing none. I believe next we have, thanks, Aaron. Items 5 through 9. Dr. Fegan, the Chief Medical Officer.
Yep, I'm here.
Thanks, Claudia. It's all you.
Okay, so the first thing is, we are increasing the span of things that we're able to do in terms of structural heart disease. These are things that we previously had to send patients out of the health system to do. So these are the catheters or the equipment we need to perform some of these structural heart procedures. They are rather expensive, but I can assure you that the dividends they pay to the health system, one, in terms of the benefit to our patients, and two, in terms of the revenue that we're reimbursed for these procedures, well worth it.
Okay. Any questions on this?
So
Claudia.
the second one are the this is support for these specialties where we do not necessarily have the volume of work to keep multiple physicians busy, and yet recognizing that having only one cardiothoracic surgeon or one surgical oncologist is not adequate coverage, or one, or in terms of pediatric surgery, we don't have the volume to employ multiple full-time folks for these areas. And yet, because we are a trauma center, we do have to have 24/7, 365 coverage for pediatric surgery, for colorectal surgery. The oncology and endocrine surgery are specialized. And so while we do have an individual who does that, they do need to have additional coverage.
Okay, any questions for Claudia on this one? This is request number 6. All right, Claudia, go ahead to request number 7.
Okay. Yeah, this is for our emergency department. This is so that we are trying to expand our capacity to have patients on monitors and to do some of the work that we're doing in the emergency department. We're creating a clinical decision unit that will allow us to make decisions. Some of these patients will not need to be admitted to the hospital, but we do need to watch them for a period of time. And so this is for monitors that will allow us to provide that additional service and make those decisions.
Any questions for Claudia on request number 7? All right, moving on to request number 8, Claudia.
Okay, this is. Yeah, so this is for Provident Hospital. We are trying to get to a better place at Provident Hospital. We want to open up to ambulance runs. And once we begin to receive ambulance runs at Provident, which we haven't done for a number of years, we're going to need to have more monitoring. We anticipate we'll have sicker patients. And this is all part of trying to grow what we do at Provident. We reopened the critical care unit, and now that we have done that, we want to be able to receive those patients from the emergency department. We have to have monitoring in place there.
Helping to build our infrastructure up at Provident, I think is critical, because as we've seen, people come into the South Side and then disappear from the South Side or pull back their services. So,
well, exactly. I'll tell you that prior to us stopping ambulance runs almost 10 years ago now, that Provident was the second busiest emergency department in the city. So we're trying to get that infrastructure back in place.
Yeah. Any questions for Claudia on this? I believe this is request number 8. All right, hearing none. Dr. Fegan, why don't you go to request number 9?
Okay, so let me see what this one is. Yeah, this is all more of what you would refer to as infrastructure. This is more of the equipment and that we need for the emergency department, and to when, quite frankly, we'll use additionally in the critical care area, but allow us to do more of the things that we want to do at Provident. So more stretchers and the kits that we need to take care of these sicker patients. All of that goes with an ICU and emergency care.
All right. Any questions on request number 9? Okay, seeing none. Thank you, Dr. Fegan. We're gonna move on now to request number 10, which is going to be presented by Shannon Andrews, our Chief Equity and Inclusion Officer.
Good morning. Thank you, Chair. Again, Shannon Andrews, Chief Equity and Inclusion Officer. This item before you is for the amendment and increase to a contract with Med1 Capital. This is on behalf of the Materials Management Department, who is charged with ensuring the logistics and operations and management of infusion pumps, both for our nursing and clinical providers. This dollar value will allow for continued payment of our lease agreement through the end of this contract, which is set to expire in December of 2022 this year. Materials management is engaged with supply chain management and end users to identify an appropriate contract mechanism to continue this service post that expiration date. But this item before you today is specifically to increase the dollar value for continuation of services. Thank you.
Thanks, Shannon. Is there any questions for Shannon? All right, hearing none. We're going to go to
Director
finance.
Kelly,
Oh, sorry, Mike.
Yeah, I'm a little confused on the timing here. Is the RFP runs through, I'm sorry, the extended contract runs through December, or the extension takes us into 2023?
The request for today that's before the Board of Directors is for an increase in dollar value. So this contract is scheduled to end in December of this year. This increase of funds will allow for the continuation of payment on those leases. We did see an uptick of utilization in the past 2 years, and so this is just for money.
Okay, so then are we going to rebid this? Or is this going to? I'm just curious, because if the contract expires in December, if we're going to do an RFP, we would need to be getting that underway fairly soon, wouldn't we?
That is correct. That is my, as I stated, materials management is currently working with supply chain management and the end users to ensure that we have a replacement for this for once it ends in December. So we will be back before the board with a new contract post that experience with supply chain management.
Thanks.
Thanks, Mike. Thanks, Shannon. Any other questions for Shannon? All right, hearing none. We're going to now move to request number 12. Valerie Amos, our Chief Human Resources Officer, is going to present request number 12.
Chair Ryder, I believe we're on the Pamela Casera item, which is 11.
I skipped Pam. Sorry, Pam.
Thank you.
No problem. Pam Casera,
Sorry.
Chief Financial
I just lost
Officer.
I lost my place. I'm not usually the guy directing all the individual items like this, so I think I did pretty good getting us halfway through. Go ahead, Pam. Sorry.
Yep, no worries. This item is a vendor who will work our workers' comp claims. They have the expertise and the bandwidth to work these, which is specialized. As you know, workers' comp often takes a long time, sometimes years, for those to get settled. This vendor will work with between the insurance carriers and sometimes legal to get that accomplished. It is a contingent contract, which means if they don't get us anything, they don't get anything either. They have identified the opportunity in year one is up to $5 million that we can recoup, and up to about $3 million in year two. Any questions?
Any questions for Pam?
Thank you.
All right, hearing none. Thanks, Pam. Now we're going to move on to Val.
Hello, Chairman Ryder. Thank you so much for the consideration today. The request before you is really an extension for an additional 6 months for Slalom, who is our vendor who's been supporting all of our process improvement initiatives within HR. As you know, HR is the hub that is going to be able to support the rest of the organization. We have been challenged with our own resource or staffing issues, and so we brought in Slalom, who's been with us for 6 months, and they are set to extend their contract with us to assist with not only decreasing the hiring delays, as well as also building out some technology solutions, working within our HIS team, the Bureau of Technology team, so that we can drive our business. So the request before you today is really a continuation of services for an additional 6 months, set to expire, if we scroll down, in January of 2023.
Okay. We have someone with their hand raised, but I don't know that I can see it on the screen. Who's Debbie?
I think it's me, Director Harrington.
Oh, okay.
Yeah,
Go ahead.
Yeah. I'd like to, if possible, get a 3-month interim report about how things are going in terms of this project, since we're only talking about a 6-month period, and then we'll be into January. And so it'd be good to know how things are going in a 3-month period as we move toward the end of the contract.
Sounds great. Thank you so much. We do have deliverables in their contract, and they are hitting targets and working tirelessly to help us. So thank you. We can certainly provide that at the next meeting, or in the interim, we can provide it to the secretary to present to you personally if you like.
All right.
Thank you.
We have a human resources committee. We have a human resources committee too, right?
We have a meeting next month, just
That's, yeah.
FYI.
Yes.
Okay.
And I can expound there too if you like. Absolutely.
Yeah. Yeah. Because the metrics on the contract probably are relevant to that as well. So, all right. Any other questions for Val on this?
I have one other question. This is Director Deere. Valerie, can you explain again what actually they are doing? I understand they're helping to improve services, but by what means? How are they doing that?
Absolutely. So good question. Although I spoke about it at previous HR committee meetings and some of the board meetings, Slalom has really been brought in for process improvement initiatives. So for instance, our recruitment processes at other organizations, it might take about 5 steps. And with us, there are many layers and complexities associated with how we recruit. So they've been here to identify our current processes and assist us with moving towards the best practice process. So they've been incredibly helpful with identifying opportunities for us to revise our hiring plan and work on training. So we've trained a number of hiring managers, more than 200, I believe, have already been trained with that. So it's those types of things. They've also been assisting us with standing up daily hiring meetings so that we can focus on our priorities, remove any blockers. They've been also working on our technology solutions. So they've come in, conducted a needs assessment, worked with some of our senior executives in terms of identifying what their pain points are. They've developed plans along with myself to drive more of a strategic roadmap for HR so that we can build out some sustainable hiring initiatives. So that's in short order. They also will be assisting us with all of our virtual hiring events, and they have assisted us with our past on-site hiring events as well. So that gives you a flavor.
Thanks so much. I appreciate
So,
that.
yeah, I liken this to, we've vastly improved our processes on budget and financing over the course of the last few years. That
Right.
started with when Andrea was in as our interim chief business officer, and we brought in a consultant for that, and I think we've done an incredible job with that. Now we're the focus on HR, and as we know, the whole world is facing challenges on that, and there's some obvious solutions, but we've always had a historic problem with process, and I think that the CEO's strategies working with Val on how to attack these these types of challenges. I'm pretty excited that seeing this through, and this being another big win for us in terms of improving our organizational culture and structure and process.
Absolutely. And ideally, we'd love to see the throughput change. We won't see it, overnight, but I agree with you, Chair Ryder. It will take some time, but so we're being very thoughtful with this process to lean out some of the waste that we have within our own department in terms of how we conduct business. And so they've really been strategic partners to do that, and they're physically here at times, and we have our steering committee meetings with our CEO on a monthly basis. We meet with them on a weekly basis and all throughout the week, but they are with our recruiters, they're with our HRIS manager working on some strategic initiatives. So that's a flavor of it. They also will be working with our chief experience officer on employee experience, because all of the recruitment in the world is helpful to attract. We also need to focus on retention, and so they'll be working with our chief experience officer and myself under the direction of our CEO on some special initiatives there so that we can help really promote some employee retention as well.
Great. If there's no other questions for Val on this one, Val, go ahead and move on to the next item.
I think I just have one today.
Oh, you just have one. Sorry.
That's okay. I was Pam
perfect.
before, and now I'm Bina. So I'll turn it over to Dr. Peters.
All right. Bina, you're up. Our Chief Nursing Officer. She's got requests number 13 and 14.
Good morning, Dr. Ryder and the Board of Directors. This request is to increase the existing agency contract with VIA for $75 million, because there is an amendment to this due to the recent COVID crisis. So basically the amount is calculated based on the existing nursing vacancies and also the nursing HR hiring plan. So this is as a temporary request until we replace the regular agencies with the regular staff. And the reason for the amendment to increase this request to $75 is due to the existing COVID inpatient needs. We increased the COVID units from 1 unit or from 7 patients to close to 30, and that required extra staffing to support the projected as well as the existing need. Also, this request includes to support the nursing staffing needs for the expansion of the ambulance run as well as the CDU for the emergency room at Provident and also at Stroyers. So with that, any questions for the request?
I'm on my phone, so I can't raise my hand.
Yeah, but we can hear your voice well and clear. So go ahead.
Indeed.
Okay. Dr. Peters, quick question, and maybe I should direct this to Pam. Pam, what is the relationship between the 75 million and the other requests that you're making to the county commissioners or made in May? What was that dollar amount?
Actually, I don't have that amount available at my fingertips. Maybe actually Bina or Charles do, but the 70 million is to run us out through the rest of the year. 75 million is hopefully to run us out through the rest of the year.
Okay. And was there not a request to the county commissioners in May?
I can speak for the request to this board, not the county commissioners. I know we requested $64 million, which was approved from this board, and those amounts, we just ran out of the amount due to the factors I explained, due to the vacancies as well as that also supported the COVID, staffing needs.
Director Story, you may be referring to the transfer request, so that there's not a direct correlation between the contract amount and the transfer request, right? We do the contract for lump sums, but as we need the transfers to cover those, then we do those over time. Does that answer your question?
Yeah.
Yeah.
So
one was a transfer, and this is
The most simple way.
Thank you.
yeah, and we approved the transfer. Go ahead, Rosario. I'm sorry.
Yeah, I was going to say
I'm
that
fine.
the most simple way to put this, the transfer is for items that have been expended, and sometimes we have to make adjustments within our budget to pay for the expenditure. And so sometimes we will have to ask a transfer line from, for instance, from our employee services line to our agency line to be able to cover the fact that we had a greater amount of agency than we had forecasted in our original budget. But a contract was authorized and we paid and we did what we needed to do to maintain safe staffing. This is seek authorization for future work based on the estimation that we have right now, and to make sure that we don't run out of authorization to ensure safe patient care at our acute centers, as well as the current surge that we're going through COVID and other expected delays. We want to make sure that we have the authorization from the board to proceed and not endanger safe care. And so this contract is based on the use that we have right now into the future. What we would need to finish out the year and finish the budget appropriately with the authorization and meet safe staffing requirements. And so while we have many other things going into place that we hope we will hire and retain our own permanent staff, and we won't fully expend this, if there are no changes, and we're hoping there will be, but if they're not, then this is the anticipated need that we will need to maintain safe staffing. So this contract is about the future. What you're asking, Director Story, was about the past and what we did to maintain safe staffing amidst the COVID surge that most facilities did across the country.
Yeah, and I think Otis is clear on that now. So, but thank you for the further explanation. I also had a conversation with Bina during briefing to make sure that we were to make sure that we had good projections on this, so we would not have to circle back again before the end of the fiscal year to revisit it, because things. I know there's not a lot of time left in the fiscal year, but these things always come in for adjustment again. And I know Bina and her team feel like and Pam feel like we're in a pretty good spot. Joe, you have your hand up.
Yeah, I just wanted to make an observation, not a question, it's just more an observation. And it's relative to COVID and how COVID has really impacted the American workforce and how people now seek jobs, what people are looking for in terms of a job. A lot of people, and particularly younger people, are not looking for job security, but they're looking to make as much money as they possibly can in a short period of time. And so this may be something that is transitory, or something that we're seeing as a dramatic shift in how people approach work and what they want to do and how they want to do it. And so I think as we move forward, we need to be mindful of that this may be something that appears to be temporary, but it may in fact be long-term. And we may have to really rethink what we're doing in the context of what we're seeing right now. So it's just a word of caution because things have changed dramatically as a result of COVID. There are opportunities available, particularly for nurses that were not available in the past. That may change, it may not. And we need to be monitoring that and be prepared to adjust accordingly.
Yeah, I think our goal is to make sure that we fill our full-time positions, but also, look towards strategies where we're competitive in the marketplace and all the different ways that people are engaging in work. And that's been part of the conversation, specifically with nurse hiring, nurse staffing, and how we're viewing these contracts, and also labor relations. And I know that Israel and Bina are very, very focused on that, Joe. So, and this goes to our overall, like, making sure that we're constructing the right human resources portals to, continue to improve like we have so dramatically in other areas. Any other
Thank you.
questions?
My hand's up, Director Deere.
Oh, Dennis, go ahead. Yeah.
Thank you so much, Mr. Chair. And again, I agree wholeheartedly with what Mr. Harrington said. We're seeing that not only in the healthcare sector, but every other sector for that matter, given COVID. My question is can you give us an update on the status of our vendors getting paid from our GPO and getting paid on time? What is that looking like, and how are we looking to improve that?
Well, I would say we can definitely give you an update. I think, Bina can get you the update with Pam on where we are with our current vendors, so we can make sure we get you that report. But I think part of the process to ensure timely payment is to make sure that things like this, that we estimate the proper utilization into the future, so we're not delaying any authorization needs that need to come forward, and then making sure we have the transfers in place on time to make sure that no payment gets disrupted. And that's really trying to get those two things in alignment as quickly as possible. So I know that's why Bina worked with Pam and with our finance and director to make sure that we forecast this out so that we have the appropriate authorization, and then the transfers will come as we expend it, and we need to make sure we're staying timely on those to ensure full processing of payment.
Thank you, Mr. Rocha. Chair Ryder,
Thank you.
definitely, Director, definitely will come back with the process and a plan and some of the barriers that we are removing to make sure that the timely payment is done.
Thank you, and I look forward to that. My second question is, can you also, when you give that report, give us a report on how timely the GPO is filling these gaps for us, and ensuring that we have adequate staffing for our nurses from the nurses registry, because obviously that's why we're contracted with them. So is this happening in a timely manner? If not, what are the hiccups? Are there areas of improvement there? That would be helpful. And I think that, if my memory serves me correct, we were supposed to get either quarterly reports on that anyway. And I haven't seen it. So if we can get those, that I would be appreciative.
We'll do that. Yes, we are supposed to come back with an update soon to the board. So we'll do that.
Thank you so very much. I'm grateful. I yield back, Mr. Chair.
Thank you, Commissioner. Any other questions for Bina on this item? I'm sorry, this is, which request number is this? Debbie,
16.
I'm using the screen. 16, okay. All right. So,
Request,
no,
request
that
number
can't be 16.
17
It was
now.
13, item 13.
Okay, all right. So request number 14.
Yes, this request is, we have an existing HRSA grant to implement the APR and fellowship/residency program. And this particular request is to support the director of APR and practice that is managing this grant. And this grant will end in 2023.
Any questions for Bina on item number 14? All right, hearing none. Thank you, Dr. Peters. We're now going to move on to request number 15, nursing and ops development. Oh, Bina, you're still up on this. It'll be Bina and Lawrence Reed, our interim chief administrative officer, operations development, presenting on this one.
I can take it if you'd like.
Okay, please proceed, Mr. Reed.
Morning, Mr. Chairman and Directors. Lawrence Reed for Cook County Health. This first of 9 contracts we're requesting for operations included, as we just talked about, the nurse call system. This is to provide architectural and engineering services for the design and replacement of the overhead paging and nurse call system. We have to continue our operations while we evaluate and replace this system. So this engineering expertise will provide us with insight on how to design and implement the new system in a phased series. Questions about that?
Any questions for Lawrence? Hearing none. Lawrence, you're also presenting on the next group, taking us out through the end of procurement items. So why don't you go ahead and
Yes, Mr. Chairman. 8 more here that I'll get through for us this morning. Absolutely. So this next one
you're up until now, up until this point, Claudia had the biggest chunk. So now you win the contest.
Thank you.
Okay, go ahead.
I will donate it back to our operations. Thank you so much, Mr. Chairman. This next one is for custodial equipment, cleaning equipment to keep our facility sparkling clean. It's basic equipment, vacuum cleaners, shop vacs, floor polishers, and so forth here from our vendor, W.W. Granger. Questions there? They're through our GPO, of course.
All right, why don't you move on to the next one?
Yes, sir. This next one is for facility support services and management, Jones Lang LaSalle, expertise in the area of facility operations and compliance, documentation, policies, inspections, and so forth to comply with city, state, federal joint commission regulations for the safe operations of our buildings and facilities and systems.
All right, any questions on this one? All right, keep rolling.
Sure, keep it going. This next one is for nitric oxide. That's a pharmacy gas. And so this one is something that we've got a vendor who has the patent on it. So they're able to command pricing control of this, but it's necessary for our operations. It provides gases which allow us to manage the blood flow of patients. This affects their blood vessels. It serves as a vasodilator and decreases blood pressure. This is a renewal of what we've used before.
Any questions? All right, next one, Lawrence.
For the maintenance of our boilers, they continue to age. Stroger's coming up on 20 years old. This is to maintain our boilers and service them, keep them in good working order throughout the cold months.
All right.
The next is temporary staffing the discussion we just had applies here to these as well. This is for respiratory therapists, as well as some other support functions, folks doing screenings for vaccinations, telephone operators, call center operators, patient transporters, greeters, and so forth. As always, we endeavor to hire our own permanent employees for this sort of work, but in the absence of them for the moment, this keeps our operations going.
Who's the contractor on that?
This is cross country.
Providing that service.
Yeah, cross country.
Thank you.
This next one is for construction, demolition, and other such services for our former Oak Forest campus. This is under downtown's CIP. Cook County Health is still the owner-operator of record, so it passes through us here. But day to day, we're not a party to this transaction. Just more of a pass-through, as they explained to us.
All right. Let's keep moving.
Yep, two more for you here. This one is for the maintenance of our brachytherapy equipment. This is for the treatment using radiation therapy. The devices that we use have to be maintained, of course, and so the original equipment manufacturer is the organization that we award to maintain this equipment for us. I see a hand up, Mr. Chairman.
Yeah, this is a question about the overhead paging system. It occurred to me that I haven't even heard that term used in years. and I'm just curious as to what we mean by overhead paging and in the context of the technologies that are available to us today. I haven't been in a hospital in years where I remember growing up and being in hospitals where typically you would hear conversations overhead, and that hasn't happened in a while. And so I'm just curious as to what we're talking about in terms of the new system.
Of course, indeed, Director, as you point out, it's and especially the future is more complex than merely overhead paging. This does include overhead paging, and such as in emergencies like a separated child or calling a code in emergency. But this technology and our application of it currently includes a nurse call system. So how somebody might push a button and summon a nurse or other caregiver to their room. As the technology moves forward and more modern applications of it, it's even to communication devices that are personal communication devices. You might carry it on your person, such as a cell phone with a headset or something like that, so that you could be summoned directly and quietly, and only you. And we might know where our caregivers are through geolocation throughout our facility as well, so that we can bring them in as needed more locally. Bina, do you want to expound on this a little bit more for us here today?
Thank you, Mr. Reed. Just to, the technology what we have is pretty old, and I think, Dr. Harrington, you made an excellent observation. So with this request, we will evaluate our infrastructure as well as the modern technology. Ideally, a patient should be able to communicate to the nurse directly, and also the communication between all the providers and the interprofessional team the same way, so we can avoid the noise level of overhead page. So this is the starting point to create a modern technology to support the operational need as well as the nursing communication need.
I'm very happy to hear this, but I also know that means that we're going to have to spend more money moving forward. And I'm excited to find out what the new innovations are and how we can bring our institution into the 21st century fully.
Thank you. After this evaluation, we will do an RFP process to get the best vendors to support the initiatives. Thank you.
All right. Is this
Mr. Chairman? Yeah, this was our maintenance on our radiation therapy equipment. The OEM, of course, maintains their own equipment for us, so that's that one. The final, any questions about that radiation therapy? All right, and our final one today, this is for diesel fuel. This is the fuel for our backup emergency generators, both at Stroger and Provident, both for this year and next. We consume fuel because we have to test those generators monthly to ensure their function, that they would switch on automatically and perform that emergency power generation. And so for that, we end up consuming fuel, and this is to purchase and replace it. Mr. Chairman, directors, those are my contracts for you today. Thank you for your consideration.
All right. Thank you, Lawrence. As I mentioned earlier, we're going to hold these items for our combined motion that we'll be considering later in the meeting. I'd like to now go to our Chief Procurement Officer, Charles Jones, who's first going to report on minority and women-owned business enterprises participation. Charles, let's hear those golden tones.
Yes. Again, good morning, Charles Jones, Chief Procurement Officer. Before I get to the NWBE, I'd just like to say for the procurement items and contract, the 23 that was presented by the executive directors, all 23, the executive sponsors, all 23 requires letters of responsiveness from the Office of Contract Compliance, and we received 13 back, so that's 10 outstanding. Okay. So for NWBE, now if you look at the two most recent columns, the two most foremost columns to your right, we are providing to you the month of May now. So there was 19 contracts presented in May to you. Of those 19, 8 had contract-specific goals for a little bit over $20 million. 2 of those 8 were was Prime. The MWBE was awarded primes for $350,000, and 4 of them were subcontractors for $6.5 million. So 6 awards there for around $6.8 million. There was 2 full waivers during the month of May. One for the Health Plan Services Medicare HEDIS software contract that was $511,000. And then we had a waiver for the offsite central storage of the medical records and retrieval contract for $480,000. So that totaled up to $991,000. All total, the month of May, it was 34% participation. Looking all the way to the far right, and year to date, 48 contracts had goals for $286 million. 5 of those were primes, $5.3 million, 28 subcontractors, $63.1 million. In total, 33 vendors, minority vendors with awards for a little bit over $68 million. And there was, the year-to-date 15 waivers. Next page, Debbie, for the visual. We have the bar chart. So we are, with the little slip up in March and April, we are trending back in the right direction in May with 34%, 24% year to date. Any questions on the metrics?
Well, remember, it's not a slip ups. Slip ups are when you make mistakes. Those were just dips that happened because of where we were at in the cycle. So.
Thank you, sir.
Any questions?
No questions.
Right, great.
Thank you so much for this report, Charles. I'm appreciative.
Thank you, Commissioner Deere.
All right, Charles, you want to move on to emergency purchases?
Yes, we had 3 emergency purchases, 2 in the month of June and 1 right at the beginning of July here. This first one is the Executive Search Group LLC, 12-month contract for various mental health recruitment services, $500,000. This is to provide mental health recruitment services on behalf of CERMAC. This company had specific niche type recruitment that they can do in the area of mental health specialists and licensed clinical social workers on behalf of CERMAC. Next request.
All right. I have a question. I have a couple of questions. I apologize.
Okay, go ahead, Otis.
Raise my hand. But Charles, what is I understand the need for staffing. We all know the great resignation, all that. But why does this warrant emergency requests? What has happened in this workforce over the last 12 to 15 months that we haven't known about that makes this all of a sudden it's elevated to an emergency purchase?
Okay. For that, I'd like to have Mr. Rocha, the CEO, answer that question for Cermak.
Sure, I can answer. This is something we have been working with our Chief Operating Officer at Cermak, and it was not a sudden request. The emergency comes as a last resort of finding staff. We have worked for several months watching our staff members. We have had retention and recruitment and exits and retirements, and so we have to monitor our safety. As you know, Cermak Health is the largest behavioral health entity, pretty much probably in the state, that we care for, has the largest amount of psychiatrists, single site behavioral health provider, and we have to maintain certain levels of safe staffing. We have for months tried through our traditional contracted vendors to be able to place and to find and recruit both permanent staff and agency staff to be able to have behavioral health services. Behavioral health services specialists are the most in demand, the greatest, and they have the greatest shortage of volume right now, and they're the most difficult to find. And so after several months of not being able to find and utilizing things like telehealth services and others to be able to keep up a safe matrix of care, they were able to procure some staff placement through this firm that where others had failed to be able to find the resources that they needed. And so given the fact that we have to always look at our ratio where we were at and having not been able to locate staff through the ongoing months that we had through our traditional contracted vendors, the emergency was, given that we had tried, been unsuccessful with our traditional vendors and contracts, and to maintain safe care after trying to locate it, and these were able to get them here immediately and be able to get the services that we need, and still not the number that we need, but at least some that can be deployed immediately to ensure our ratios of care. That was the emergency. The emergency didn't come overnight. It came over several months, watching our retention and recruitment continue to transition as our employees either retired or transitioned to other opportunities, and then looking at the need. And we also have had a greater census of patients, and we've had to rearrange our location because of COVID. And so a combination of factors of COVID, our ability to maintain safe staffing, an increase in population, and being able to make sure that we keep up, and then also having our current contracted vendors not be able to successfully locate and procure behavioral health specialists. The combination of those factors created an emergency that required this contract to ensure safe staffing. And that was done under the review of our Chief Operating Officer for Cermak Services after trying to work through those services. And I think both Charles and the Procurement Division can also discuss that they have been trying for a while to locate behavioral health specialists through our regular contracts with no success.
So emergency purchases are, in operation or in practice, are perfect storm situations. And that's sort of the situation here. Charles, do you want to talk about what qualifies real quickly, just what qualifies as an emergency purchase, just to remind folks?
Yes, sir. You would do that to me. There's several things within the policy that enact for emergency purchases. Obviously, where there's a threat to public health or public safety, where there's immediate purchase necessary for the repair of the system property in order to protect against future loss or damage, and to minimize serious disruption in system services, or to ensure the integrity of the system records. So in this case, I would think that it's definitely the threat to public health or public safety, and to minimize the serious disruption in service at Cermak.
Charles, thank you very much for that explanation.
I'm sorry.
I appreciate that. I said, I appreciate your explanation, and I value that, and I understand that. It wasn't necessary for you to do that. My concern is that, as you said, Israel, that this has been a challenge over the last several months. That being the case, mine was just a simple explanation. you know, emergency, knowing that this was happening. I'm not trying to be a Monday morning quarterback. You know, why weren't we in the market 3 or 4 months ago for a preferred vendor to do this work? That's all.
Sure, and the answer is that we kept being told by our vendors that they were going to procure the staff, and we utilized other means. We brought in telehealth, we brought in extension of services. We have explored every option to try to avoid just defaulting to either extending more contracts when we have existing contractors or saying they're going to, but at some point we have to take action. And we actually were trying to get other vendors, and we're just saying, do you have any staff members that you can place? Most of the vendors that we were contacting were telling us they did not have behavioral health specialists. So when we hit both a vendor that could supply them, and we started looking at where we were with the ratios that contracted, and this is a limited scope contract. If it works, we will convert and do a full RFP for, we are going to be working on more vendors. So this is not a something that we did without thinking through that. And so we hope that this is something that we will go to a permanent expansion and look for other vendors who can be able to meet our mental health services needs. But this is a national shortage, and mental health specialists are the greatest compromise field in being able to do that. But it was not, again, we found someone after having looked for months, and it's not something that we were waiting. We looked and explored multiple avenues of options to be able to get us to be here and to render care. And there's still some more that will come forward, and we're trying to contract to traditional means. However, given the need and urgency, we just sometimes have to make the decision that this is an emergency.
So if I can jump in, Israel, yeah, when you have an emergency purchase like this, the contracts are like, a limited duration. This is a year, staffing contracts usually are multi-year contracts with renewals. This is probably one of the smallest amounts. It's limited to $500,000. And I would assume, Israel, that we are going to also continue to work with our other vendors who we are working on with staffing to try to continue to utilize them as well and supplement while we work through how to do this procurement for next year if the need continues to persist.
Thank you for the explanation, and I'm sure you have an SOW associated with this contract going forward.
Yes.
With the appropriate deliverables. Thank you very much. Thank you, Charles, also.
You're welcome. I see Director Harrington has a hand up.
Go ahead, Joe.
Yeah, I just want to bring attention to something that Israel brought up, and he referred to Cermak Health System as the #1 provider of behavioral health services. Most of us know that that's associated with Cook County Jail, and people probably don't think of Cook County Jail as a place where people are in jail and have these behavioral health problems. I went back and took a look at the WE plan from Cook County Department of Public Health and saw that, and I think this is on page 18, figure 3, mental health was the second leading response to the question, what are the most important health problems in your community? And mental health was the second biggest problem. And it's clear, and I don't want people to lose sight of the fact that we have some very serious behavioral health problems, not only in Cook County, but our country. And so I think what we're doing is not only needed, but we may need to take a closer look at this because it's a larger problem than people may perceive.
Yeah, and we're suffering from the consequences of the disinvestment in government provided mental health care over the course of the last couple decades, in my opinion. So thanks, Joe. That's one. Yep.
Okay, request number 2, Debbie. So on June 28th, we notified you of a request with UI Health for a 12-month period as well, provide immediate physician services for writers care on behalf of the Department of Surgery, $66,000. Any questions? All right, and July 1st, a request with Vega Partners LLC, which is a certified MWBE vendor for the county, provide consultant services for the Department of Public Health, building healthy community initiatives to expedite the small grant program and to begin activities on the APA funding initiatives and deliveries. 12-month contract, $100,000. Any questions?
Any questions on that one? All right.
Thank you.
We're now gonna move on to a report by our Chief Financial Officer, who we heard from earlier, Pam Casara. Pam, you want to
Thank
first
you, Chair
present the grant award related items?
Yes, thank you. There is one item, receive and file grant going to the county board next week. It is from the Illinois Department of Human Services, 225,000 increase and extend. The executive sponsors, Dr. Hasbrook, who may still be on if there are any questions. Hearing
Any
none.
questions? All right, go
Next
to the,
item.
I think transfer of funds is next.
Yes. So surrounding the conversation that we just had related to the agency and contract labor, we are bringing a transfer request to the county board next week for approval. This is receive and file for our board. $26 million. You can see pretty easily what it is we're doing. We're taking surplus salary and wages from basically every division and putting it into registry services in also basically every division to cover the vendor contracts that we have in place for agency.
The intent,
Questions?
yeah, just the intent is always to not have to do the transfer, but until we get staff onboarded, the money for those vacancies, it's not surplus money in effect that we're somehow beating budget. It's, we're replacing, we're moving it so we keep staffing levels where they need to be or get them to where they need to be.
Correct. And we'll speak to that again.
Any question on the, yeah, go ahead, Pam.
I was just going to say, we'll speak to that again when we take a look at the financials.
Okay. Any questions? Hearing and seeing none. Both of those, the grant award related items and the transfer of funds, the receive and files will be included with the group motion that we intend to bring after. Actually, we can go ahead and do that right now. Board Pam presents on the financials. I'd entertain a motion to accept item 3A, the June 17th, 2022 Finance Committee meeting minutes, and approve item 4A, contract procurement items containing request number 1 through 23, subject to completion of review by contract compliance, receive and file the grant award related items, and receive and file the transfer of funds. Is there a motion?
So move, Director Harrington.
Second.
Motion's made and properly seconded. Any discussion on the motion? Hearing none, will the secretary please call the roll?
Roll call vote on combined motion. Aye or nay, Director Deere?
Deere's aye.
Thank you, Director Harrington.
Aye.
Thank you, Director Munar. Is absent. Director Story
Aye.
and Chair Ryder.
Aye.
You have 4 yeas and 1 absent.
Great. Thank you, Debbie. Pam, back to you for your report on the May 2022 year-to-date financials.
Sure. Thank you, Chairman. Pam Casara, Chief Financial Officer, Cook County Health. Happy to report halfway through the year, in spite of all the staffing and COVID-related challenges that you've just heard about, we've ended the 6 months at a 36.1 million positive variance to budget. A couple of key drivers on that. On the revenue side, we have received some supplemental catch-up payments from the state related to the non-county care MCO directed payments, and also county care received some state corrections. On the expense side, We are continuing to have a negative variance to budget and purchase services related to the agency and contract staffing that we just talked about, but that's being offset by the surplus in salaries and wages being under budget due to the positions not yet hired. And then county care claims expenses greater than budget due to that higher membership, with the pause on redetermination related to the public health emergency. And they are at an operating gain currently at $11.8 million halfway through the year. Next slide, Debbie. So as you do look at the financials, you can see those variances I just spoke to. Total revenue, 13.5 over budget. Total expenses, 22.5 under budget, which is driving that 36.1 million positive variance. And again, looking up through that variance column, you can see salaries and wages under budget, and then the purchase service line over budget. Next slide, Debbie. The story with volumes continues to be the same. Admissions, inpatient side, basically at budget. Outpatient continues to lag behind, especially in the emergency room area. But again, just a reminder, the budget was budgeted for Provident ambulance runs to reopen, which is primarily driving that variance. But everything is doing better than last year, same time. Next slide. Just a different representation of our volumes, so we can sort of see the trend as we climb back to those 2019 pre-pandemic levels. And you can see in a lot of cases we are there, with the exception of basically the only ER visits are still lagging behind. Next slide. Payer mix, not a lot of change here. Actually, no change here currently, but I do want to mention, you may have heard just this month, July 1st, I believe, the undocumented 42 to 54 population is now eligible if they, excuse me, meet income requirements for a Medicaid-like product. And we will be monitoring this change in the payer mix to see if, in fact, the Medicaid continues to increase and the uncompensated continues to decrease. Next slide. Revenue cycle continues to meet on most of their indicators. They had a little uptick in AR days this past month. Revenue cycle chief revenue officer does have Guidehouse onboarding currently to basically blitz the old AR over the next 60 to 90 days and hopefully bring that back down well below the target. Next slide. Denials, similar as in prior months, we're tracking the pre-improvement and post-improvement implementation plan that Mr. Haley has put into place. And you can see that the post-improvement is resulting in lower dollar amounts of denials. And in addition, they are meeting the benchmark from an industry standard. Next slide. And then our charitable public program expenditures also running a little bit behind what we budgeted. This is a function, again, of both the volume, lower volumes, and we will may see an impact from this again from the undocumented that will now be receiving Medicaid benefits. Next slide. All of our initiatives related to revenue cycle capture improvements are on track, as well as the expense side of renegotiating our vendor contracts. About halfway through the year, we're at 13 million. And next slide. County care, as I mentioned, 11.8 million gain. Their budget was 11.7. So 3 million over budget, again, driven by the pause and redetermination and being able to retain that higher membership. Again, just drawing your attention to the bottom graph, we budgeted for the redetermination to start. It has not, obviously, from the extension of the public health emergency, which was just extended again now through October. So they should be able to retain that membership pretty much through the end of the year, our fiscal year, and we'll finish strong. Next slide. And then more care losing less than budgeted as they start to wind up as we are exiting this program at the end of the year. Any questions?
I don't have a question, but Pam, you said it, so I won't totally restate it. I think looking at the 41 to 54, as that population shifts, first of all, it's a great humanitarian endeavor that the state has engaged in, and hopefully it will be impactful on your budget going forward in terms of inverse relationship between charity care and the number of recipients that will be now covered going forward. So that's good news.
Yes, thank you, Director Story. And we have done some data dive, and we believe we have about 4,000 existing patients that would fall into that category. Any other questions?
Any other questions for Pam? All right.
All right.
Hearing and seeing none. Thanks, Pam. Well, we've come to the end of our journey today, so I want to thank everyone for attending our meeting. Our next scheduled meeting will be, drum roll please, on August 18th at 9 a.m. And I look forward to not only seeing you there, but also at our next board meeting. We have exhausted the agenda, so the meeting is adjourned. Thank you, everyone.
Thank you.
So long.
Thank you. Bye-bye.
Have a great day.